The Louisiana Department of Health says it will stop promoting mass vaccinations, instead urging individuals to consult their doctors about the risks and benefits. An internal memo obtained by CNN from the state Surgeon General advises health workers to treat vaccines with nuance, noting the difference between seasonal vaccines and childhood immunizations. I'd like to bring in the founder of Louisiana Families for Vaccines, Dr. Jennifer Herricks. Doctor, thank you so much for being with us. What do you expect is going to be the impact of this move to stop promoting mass vaccination?
You know, really worrisome step, because when these clinics were active, they provided thousands of Louisianans with essential vaccines every day. So without them, the fear is that many families will not even be able to access routine immunizations. And I worry that we're going to see vaccination rates drop dramatically as a result, and then we're going to see increasing disease outbreaks.
The director of New Orleans Health Department says that her department is not going to abide by the state's directive. I wonder what you've heard from local public health officials and how they plan to handle this.
Yeah, for those who can, like the New Orleans Health Department, I think it's going to be so important. It's going to be important for other nonprofits, including our own, to really try to promote vaccinations and accurate information, because even, the Department of Health, their website now has misinformation on the website.
What does it have on it?
So they released a statement kind of going along with this letter that was released about their new vaccine policy. The statements are purposefully misleading. So they deceive the public by claiming that COVID vaccines don't prevent transmission, when we know that they reduce transmission significantly, though not by 100%. They distort the truth, falsely stating that vaccines are liability-free, when in reality there's an entire federal program that ensures swift and fair compensation for vaccine injuries that are very rare, allowing claimants to even reject the settlements and then sue in civil court if they're not happy with that original settlement. They also misrepresent the risk, making vaccines, seem like they cause more harm than they do. We know that the risk from vaccines is exceedingly rare, but the adverse events that are caused by the infectious diseases they prevent are far more frequent and have severe long-term harm associated with them.
So, doctor, what would be your message to parents who are skeptical about vaccinating their kids, who welcome this decision?
I hope that those parents have a relationship with a pediatrician that they can go to and talk to about these concerns. And, I know that that's part of the message from the Department of Health, is that there should be better relationships between patients and doctors. But again, vaccines are one of the safest interventions that we have, and the role of public health is to both inform and provide access to preventive care. And vaccines are one of the best and most cost-effective ways to do that, and to significantly reduce the disease burden for families. So not doing that is really going to impact especially those families who don't have a relationship with their doctor like that.
Dr. Jennifer Herricks, we have to leave the conversation there. Appreciate your time.
Thank you.